This is hip routine 1. We're going to do a gentle butterfly stretch, lying on the back. Then you're going to come into a seated position and do a butterfly stretch again, folding forwards. We're then going to do a cross legs and fold both ways. And then we're going to come into a seated hip stretch and a seated straight leg stretch. And we're going to hold each position for a minute. We're starting lay on the back. You can be lay on the floor, on the bed, wherever's comfortable. And we're going to slide both feet in and then allow both knees to drop out towards the side. So we're not going to force the knees out. We're just going to allow them to drop, and we're going to stay here for a minute. So let gravity do the work for you. Just relax and breathe. If the knees are hurting, it can be useful to slide the feet a little bit further away so there's less of a bend in the knees. And just relax and breathe. You should be feeling a pull on the inside of the thighs into the groins. One side may feel a little bit looser than the other. Stay here for another 20 seconds. And then we'll gently raise those knees up, maybe a little bit stiff. And then from here, we're going to move straight into a seated position. If you need to, if you feel quite stiff, you can place a cushion or a bolster underneath your backside to raise you up. It will make it a little bit easier. And then again, we're going to slide the feet in, and we're going to allow the knees to drop out towards the side. And then we're going to gently fold forwards, and if you want, you can use your elbows and arms to push those hips outward a little bit. And again, we're staying here for a minute. So don't force it, be gentle with this. It's more one to do gently, regularly, than trying to force it and get it to release quickly. We'll stay in here for another 30 seconds. It can take years for the hips to stiffen up, so they're not going to free off overnight. And then just gently stand yourself up. Allow those legs to release for a moment, give them a little shake. And then we're going to come into a seated cross-leg position. So don't draw the feet in too far in because it can make the knees sore, but we're going to cross those legs and we're going to fold forwards. And you should feel a pull in the back of one or both hips. Make sure you're breathing. Just breathe and relax into the stretch. Again, don't force it. Stay here for 30 seconds. If it gets particularly uncomfortable, by all means come out early. And then just gently sitting back up straight. And we're going to release those legs and cross them the opposite way. And then fold forwards again. And this time you might feel the pull in the same hip, it might have moved across to the other hip, it all depends where you're feeling the tension. And as before, relax and breathe into the stretch. Don't bounce it and don't force it. Stay here for another 30 seconds. And then again, just gently draw yourself back up. Allow those hips to release. And we're going to turn and bring ourselves into a seated position with the legs over the side of a chair or the side of the bed. So we're going to do our seated hip stretch next, or our piriformis stretch. So we're going to place the right ankle on the opposite knee. Sit nice and straight, and then just gently fold forward until we feel a pull in the back of that right hip. We're going to stay here for a minute. Any knee pain, lower back pain, by all means just back off. And as always, if it gets too painful, then do stop. Make 30 seconds to go. Make sure you breathe in, just relax and breathe into the stretch. And nice and steady. Just draw yourself back up. Release that right foot down. And we'll repeat that on the left side. So placing the left ankle to the right knee. Again, sit straight, gently fold forwards until you feel a pull in the back of that left hip. And again, we'll stay here for a minute. As before, make sure you breathe in, don't hold your breath, don't force the stretch. Just keep that nice, gentle, consistent tension. Stay in here for another 30 seconds. Gently sitting yourself back up. Release that left foot back to the floor. Give the hips a little bit of a movement and a shake if you need to. And then moving into a straight leg stretch. So we're going to straighten out the right leg, keep the foot relaxed. Again, sit nice and straight. And fold forward until the pull's felt in the back of that leg. We're going to stay here for a minute. Pull might be felt in the hamstring, the back of the knee, even in the calf. That's fine, so long as there's no pain. If it hurts, then just back off. Stay here for another 30 seconds. Stay focused on your breathing. If you find the tension starts to ease, just gently go in a little bit deeper, but don't force it. You may find it releases on the out breath, and you can just drop gently that little bit more into the stretch. Drawing back up, releasing that right leg. Straighten out the left leg, relaxed. And again, bend forward until we feel a stretch in the back of that left leg. Staying here again for a minute. sure you're breathing. Any pain in the lower back, then ease off. Straighten the back, or stop altogether if you need to. Staying here for another 30 seconds. If the tension eases, by all means go in a little bit deeper, but don't force it. And then releasing the stretch, sitting up, allow the leg to bend, and just come back into a normal seated position. If you're comfortable doing the exercises, they can be nice to do 2 or 3 times daily. If you feel particularly sore afterwards, or even the morning after, it may mean that you need to do it a little bit less, or perhaps not be quite so vigorous. If they feel particularly therapeutic and you're not getting a huge amount of after pain or stiffness, then you can build up to doing them 5 times a day. But it isn't a case of no pain, no gain. It's important to stay within your comfort zone and just find that edge of comfort, which hopefully will make that comfort zone a little bit bigger, but without causing undue pain. Any questions, just let me know, give me a ring or a text.